Hello friends, welcome to today's class. All of us will agree that we human beings are active, vital and vibrant organisms, not merely passive beings. Endowed with the highest cognitive capabilities such as thinking, reasoning and problem solving, we go all out to use these potentialities to modulate the environment in ways that are most suitable to us. Hence, it is but natural that when faced with stressful situations, we use these potentialities to manage and cope with these situations in ways that are most beneficial to us. One of the most fascinating aspects of the stress experience is that the same stressor may be perceived in widely different ways by different individuals. For instance, some people may find the stress experience to be extremely taxing, both physically and emotionally. Others may find it to be only slightly challenging. A third group may find it to be beyond their capabilities and beyond their active control. Some may feel that they barely need to notice it and it can go unnoticed. Finally, a group may also exist who actually enjoy the stress experience and find it both stimulating and motivating. Psychologists have long recognized this fact that a person's perception of the stress experience depends to a great extent on his own subjective appraisal of the stressor, in terms of the discrepancies that exist between the demands of the situation and the resources that he or she possesses. Since this discrepancy between demands and resources varies from one individual to the other, it is but natural that the kind of coping strategies different individuals use differs also and varies greatly. But what is most important is that some form of coping, in whatever way it is most beneficial to the individual, should exist, because this is crucial for his or her survival. This crucial coping process generally consists of two main themes. The first may be to reduce potential feelings of stress in a potentially stressful situation, or a stressful situation that you anticipate may occur or may not occur even. So in any way, this is a futuristic goal of coping. The second involves managing and reducing the stress that you are already experiencing or which you have experienced. Why we may refer to these as interrelated goals is that managing and reducing the stress that you experience at present gives you the confidence to deal with future stressors. Secondly, reducing the potential for stress by preparing yourself for anticipated stressors automatically reduces the impact of management techniques you need to use when the stress actually occurs. Now that we have had some kind of knowledge about what the coping process is about, let us go towards defining the coping process. We'll be going over two definitions. One is a broad and comprehensive definition, the other is a simple and direct one. First, let us go to the broad definition by Lazarus and Launier. According to them, coping consists of efforts, both action-oriented and intrapsychic, to manage, which means to master, to tolerate, to reduce or minimize environmental and internal demands and the conflicts between these demands. There are certain important aspects in this definition. The first is that coping involves both physiological and psychological efforts, action-oriented and intrapsychic. Secondly, this management, which is coping, does not only include mastery. It includes something lesser than that, that is reducing the stress. Further, it can also mean learning to live with or tolerating the stress. Finally, it deals with both environmental and internal demands, and most importantly, the discrepancy between these demands or the difference between these demands. Dimmateo and Martin provide a simple and direct definition. Coping is a tool for dealing with stress, according to them, either by solving the problem one faces or by learning to live with its effects, which means either you modulate the environment to suit your requirements or you remodel yourself to suit the requirements of the environment and in any way reduce stress. The process of coping can involve three themes in terms of how an individual deals with the situation. Ideally, the individual may try to correct the problem that he faces, to correct the situation and reduce stress. Another option he may take is to escape from the stress, to avoid it because he feels he cannot deal with it. And sometimes this even involves use of risk-taking behavior such as alcoholism, drug abuse, substance abuse, or sexual risk behaviors. A third way the person may deal with the stress is by accepting it. He knows that the situation is uncontrollable and unmanageable, and the best thing that he can do to ensure his physical and emotional health is to accept it and learn to live with it. Although technically coping efforts, whether they are successful and constructive or whether they are self-destructive, all of them can be considered as coping. But our focus, both on psychologists as well as individuals, should be on coping efforts that are successful and constructive. And hence, within the purview of this chapter, we are also going to analyze basically methods that are successful and constructive. This brings us to the all-important question: what constitutes successful coping? According to Cohen and Lazarus in 1979, coping efforts can be seen as successful when the individual fulfills certain conditions. What are these conditions? First, he takes a realistic view of the situation. Second, he tries to adjust to the negative realities of the situation. Third, he tries to maintain a very positive self-image. Fourth, which is very important, he tries to maintain his or her emotional equilibrium. And finally, he tries to maintain satisfying relationships with others in the society. Thus, in the face of a stressful situation, an individual who is engaging in successful and constructive coping will try to minimize the harmful and threatening effects of the stressor and maximize the positive effects that he can gain, thus maximizing the chances of survival and resurgence. While it may be difficult to precisely determine whether a coping mechanism an individual uses is clearly successful or unsuccessful, psychologists believe that in general a coping strategy can be seen as successful when it helps the individual maintain and regain his or her physical and emotional well-being and get back to his normal life activity. Now let us see an important research by Cobb and Steptoe in 1996. According to them, there was a significant positive relationship between the amount of life event stress that adults experienced and their vulnerability to respiratory tract infections. But this vulnerability and this relationship was not just limited to stress. It also extended to the way in which they dealt with the stressful situation, which was an important factor in determining whether or not they fell ill. Now we go to two other interesting aspects in the coping process. Firstly, we see coping as a dynamic process. During the process of coping, the individual acts actively to gather as much information as possible regarding the stressor. He tries to note down all those strategies that can be used to deal with the stressor. He tries to analyze and decide which is the best of the strategy, and he tries to implement it, and based on the feedback that he receives, he may either continue this strategy to the end, or if he feels that this strategy is not so effective or that it is failing, he may change it and use alternative strategies of coping. Thus, we can see that coping is a dynamic, active interaction between the individual and his environment, and it is not in any way a static process. The second factor we are going to consider is the temporal aspect of coping, which in simple terms means that coping in fact has a time aspect. Coping can take place even before the stressor happens, it can take place while the stressor is happening, and it can take place after the stressor has happened and passed off. Beehr and McGrath in 1996 distinguished 5 temporal aspects or themes in coping. Let us have a brief overview of what those aspects are. The first is preventive coping. This happens long before a stressor actually takes place or may take place, which means that this is extremely anticipatory coping. For instance, a smoker quits smoking because he anticipates that in the future, probably his habit will make him vulnerable to lung cancer. The second is anticipatory coping. In anticipatory coping, the person views the stressor as coming in the near future, and he uses these coping techniques to adjust to it. For instance, a person is going to have a surgery and he is feeling extremely anxious about it. So he may take some tranquilizers to increase a sense of preparedness to face the surgery. Third is dynamic coping. This is actual coping as we see it, coping when the stressor is happening. For instance, while experiencing pain and anxiety during a clinical procedure, say for example chemotherapy or endoscopy, the individual may try to divert his attention to something more pleasant and try to cope. A fourth form of coping is reactive coping. This is immediately after the stressor takes place. For instance, a person who has lost a limb in a disability may try to use artificial limb or may try to modulate his activities in ways that suit his new condition. Or a person who has had a cardiac arrest may try to organize his lifestyle and his diet habits and exercise patterns in ways that suit him best. The fifth and the final form of coping that McGrath and Beehr discuss is residual coping. Just as preventive coping takes place long before the stressor has occurred, residual coping takes place long after the stressor has occurred. And this is mostly in situations where individuals have to face long-term stress. For instance, a person who has undergone a very traumatic accident, even long after the accident, he may have intrusive, repetitive traumatic thoughts. Avoiding such thoughts and learning to reframe it in more positive ways will constitute residual coping in this situation. Now we come to an all-important topic, coping goals. What are coping goals? Coping goals can be defined as the ultimate outcome one seeks to achieve in a stressful situation. For instance, getting a new job in case your stressor comprises losing a job, or studying well and clearing the examinations in case your stressor is about failing the examinations. Well, the fact is that stress research has by far neglected this topic of coping goals. But what we must understand is that coping goals are vital and pivotal to the coping process. This is because it is only the existence of some sort of coping goals which will motivate the individual to actually initiate the process of coping. Finally, all these coping strategies and techniques and methods that the individual employs are all directed towards achieving these particular goals that are set. So coping becomes the center of all the coping process. Now we'll see certain aspects regarding coping goals. The first is the cultural influence on coping goals. Researchers believe that coping goals which individuals set vary according to the cultural elements that they belong to. For instance, people belonging to individualistic cultures such as the Euro-American cultures and those belonging to collectivist cultures such as the Mexican-American or Asian cultures differ significantly in the kind of coping goals that they set. This difference generally follows 4 patterns. For instance, individualistic cultures focus more on the individual and his independence. So they are more focused on coping goals that focus on the needs of the self, whereas collectivist cultures are likely to set coping goals focusing more on the needs of others. Secondly, as in individualistic cultures, their coping goals will always emphasize on an assertion of autonomy and independence, whereas just like collectivist cultures are, their coping goals will focus more on interdependence, relatedness and cooperation. Thirdly, we have already seen that people in individualistic cultures generally believe that they can control the environment. They have an internal locus of control. So, their coping goals also focus on controlling aspects of the environment, whereas for collectivist cultures, they focus more on changing themselves to suit the environment. Finally, in line with their ambitious nature and their nature of taking risks and the facilities that facilitate the same, people in individualistic cultures are more likely to set coping goals that maximize gain, whereas in collectivist cultures, people are more likely to be defensive and protective and set coping goals that minimize loss. Now we come to a second aspect, the existence of self-focused and other-focused coping goals. Although successful coping is generally seen as minimizing one's own personal distress, this may not always be the case. For instance, the same stressful situation may consist of a number of competing goals. Some of these may be self-focused goals, focusing primarily on satisfying the needs of the self. Some others may be other-focused coping goals, which focus primarily on satisfying the needs of others. What kind of goal an individual chooses in a stressful situation will depend to a large extent upon the nature of the situation, the nature of the stressor and the importance or threat that it poses, and finally on the individual's own personality variables. For instance, many a times we see that in stressful situations, parents take steps that ensure the welfare of their children. Or in disasters such as floods or earthquakes, something we have recently witnessed in our country, we often allow people who are elderly or women and children to be rescued first. In such situations, the person is focusing on other focused goals, and this may immediately lead to an increase in personal distress. But still, this cannot be seen as unsuccessful coping. Why is it so? This is because by satisfying other focused goals, the individual does something that is psychologically more satisfying to him, and hence his psychological distress reduces markedly. Now we come to the relationship between coping goals and the locus of control. Julian Rotter's theory of locus of control put forward that persons differ on the extent to which they believe that they can actually control their environment. He believed that individuals either possess an internal locus of control or an external locus of control. Individuals possessing an internal locus of control believe that they can actually exercise control and mastery over their environments and life situations and can alter them in ways that are most beneficial to them. Hence, while setting coping goals, they are more likely to set goals that focus on modifying their stressful environments and reducing the stress. On the other hand, people with an external locus of control generally believe that they have very little control over their environment, and their environment and life situations are controlled by a number of factors such as luck, chance, fate or others, all except themselves. So, they often engage in coping goals that are directed towards modifying themselves to suit the environment. Moreover, an acceptance of the situation. We come to a fourth aspect, coping goals and the dimension of regulatory focus. The theory of regulatory focus was put forward by Higgins in 1997. According to him, individuals may possess either a promotion regulatory focus or a prevention regulatory focus. Individuals with a promotion regulatory focus may try to maximize gain and minimize loss, the kind of focus we see in individualistic cultures. On the other hand, people with a prevention regulatory focus are more likely to be protective, defensive and restrained. Their first attempt will be to set goals that minimize loss, as we see in collectivist cultures. However, although we generally say that people in individualistic cultures have a promotion regulatory focus and those in collectivist cultures have a prevention regulatory focus, this is a general term, not an absolute one. Hence, situations may exist where a person with a promotion regulatory focus exists both in individual cultures as well as collectivist cultures. But still, their interactions will be different. For instance, a person with a promotion regulatory focus in an individualistic culture, as we know, will try to maximize gain for himself. What will such a person in a collectivist culture do? He will try to maximize gain but not for himself, for others in his community or in his country. Now that we know what coping goals are, we'll come to the next important topic, that is coping strategies. Coping strategies can be understood in terms of the plans, styles, or approaches that an individual uses to manage or deal with a stressful situation. What kind of coping strategies an individual adopts will of course depend upon the nature of the situation and how he views the situation, the discrepancy between the demands of the situation and the resources that he has, and finally his own personality variables. Lazarus and Folkman in 1984 differentiated between two major coping strategies. The first is problem-focused coping, the second is emotion-focused coping. First, let us see what problem-focused coping strategies involve. Problem-focused coping strategies are directly oriented towards reducing or managing the stress that occurs in a stressful situation. This may be achieved either by reducing the demands of the situation or increasing one's own capabilities to deal with the situation. Let us take an example. You have taken a debt and it is a quite large one, and you don't have the monetary resources to repay the debt. You can use two tactics. First, you can ask the moneylender to reduce the amount of debt or let you pay in installments. This would be reducing the demands of the stressful situation. Or secondly, you can take a loan, a large one, so that you can repay the debt. This would be increasing your own resources to deal with the stressful situation. Moreover, problem-focused coping at times also involves proactive or anticipatory coping. That is coping which is directed towards enhancing your own preparedness to deal with a situation that may or may not occur in the future. This gives you a greater control and mastery over the situation and consequently lesser deal of stress. Second, we come to emotion-focused coping strategies. Emotion-focused coping strategies are directed towards reducing and managing the emotional consequences of a stressful event. For instance, these may include cognitively re-evaluating the situation, seeking emotional support, reassurance, nurture and care from those around you, sharing your feelings with others, venting your pent-up feelings such as crying or talking with others, engaging in activities that are most pleasant to you, something which you can use to divert your attention, or finally trying to search for some kind of meaning in the situation. For instance, a person who has suffered the stress of divorce may try to manage the situation in emotional ways by sharing their problems with others, by spending more time with friends and family, or by talking with others, or engaging in activities that are most pleasant to them, such as leisure activities such as gardening, reading, and so on. What we must understand importantly in this scenario is that a successful coping with stress involves the use, not only the use, but a carefully blended and balanced use of both problem-focused and emotion-focused coping strategies. Overemphasis on either one of these strategies can be detrimental, both physically and emotionally. For instance, overemphasis on emotional-focused coping strategies will drive our attention away from the practical realities of the situation and the need to act and solve the problem. On the other hand, engaging yourself in solving the problem without paying adequate attention to the ensuing stress will surely have its psychological toll on you. Although this ideal balance or blend exists, psychologists reveal that people in general tend to use problem-focused coping strategies to a larger extent and tend to ignore the emotional consequences that occur as a result of it. Research by Billings and Moose suggests that emotion-focused coping strategies are more likely used when the stressor has already passed off or when no means of controlling or managing the stressor exist. So basically, the individual has to accept the situation. Finally, they also say that on a gender-wise basis, women are more likely to use emotion-focused coping strategies as compared to men. Apart from the division into problem-focused and emotion-focused coping strategies, Coping strategies can also be divided into proactive coping strategies and avoidant coping strategies. Proactive coping strategies involve a direct engagement with the stressor, gathering as much information as you can about the stressor, noting down the strategies that you can use, selecting the best among them, applying those strategies, looking for feedback, and on the basis of the feedback, either continuing those strategies or altering them. Further, this kind of proactive coping can be not only for a stressor that you're already experiencing, but it can also be for a stressor that you anticipate may or may not occur in the future. On the other hand, avoidant coping seeks to totally underestimate or even negate the possibility of the stressor. Let us take an example. Let us take a student like you. A student using proactive coping strategies and one who wants to gain admission into the university will begin early. First of all, he will try to find out what all courses are available in the university, what is the time frame for applying to those courses, what are the regulations required, and he will follow all these regulations, apply early, and probably select more than one course so as to increase his chances of getting a seat. Although this may seem a bit anxiety-ridden at the beginning, but it can have really good consequences as it increases the chances of getting admitted. On the other hand, a student who uses an avoidant coping strategy may take these regulations and rules and recommendations very easily, and he may just feel that whenever the university opens, I will take a course whichever is available. This may seem very relaxing in the beginning but can have stressful consequences, such as not getting a seat or getting a seat in a course that you really don't want to undertake. Another classification of coping strategies is into assimilative coping or accommodative coping. People who engage in assimilative coping generally have an internal locus of control, or they engage in primary control coping strategies and try to modify and alter the environment in ways that are most suitable to themselves. On the other hand, people who engage in accommodative coping generally have an external locus of control and they attempt to alter oneself to suit the needs of the environment. According to Taylor, a famous psychologist, these coping strategies can be put under the term mastery versus meaning, because he felt that people generally use these strategies in a particular sequence. They first try to begin by assimilative coping, that is trying to gain mastery over the situation, and when they fail to do so and when they find that the situation is uncontrollable, they switch on to accommodative coping, that is accepting the consequences of the situation and learning to live by it. According to researchers, coping mechanisms have a significant relationship with how healthy or how unhealthy you can become. Maladaptive coping techniques, especially avoidant and escapist coping mechanisms, can have an adverse indirect impact on health. This may be through the neglect of positive health practices, through the adoption of negative health practices, as also engagement in risk behaviors such as substance abuse or drugs as a means of coping with stress. Further, unhealthy emotion-focused strategies such as suppressing one's emotions can have both a direct negative impact on health and indirectly can affect your moods. These moods in return affect immune system functioning, and a disruption in immune system functioning makes you more and more vulnerable to disease, which underlies the important relationship between coping strategies and health outcomes. Let us face an interesting question. Can the same coping strategies be both adaptive as well as maladaptive? The answer is yes. Let us take an example. A realistic acceptance of the stressful situation is in fact a very adaptive coping strategy. But studies by Reed et al. Have revealed that such a realistic acceptance of the situation leads to decreased survival rates in diseases such as HIV/AIDS. This is because individuals who know that their chances for the future are slim may find less interest in following treatment regimens and taking medications, due to which the disease aggravates. Similarly, information seeking, which is a very adaptive coping strategy, proves to be maladaptive in the case of patients suffering from rheumatoid arthritis because the information about the consequences of their disease makes them feel powerless and vulnerable, directly affecting their compliance to medical treatment. While concluding this lesson, let us briefly go through what we have studied. We have studied the importance of coping goals and coping strategies, and most importantly, using coping goals and strategies that are constructive and adaptive to our day-to-day functioning. Although you may use a number of coping strategies, a variety of them, and many of them overlap depending upon the situations that you are in, what is most important is that you use strategies that are active, that are positive, and that help you regain physiological and psychological well-being.